Today, I'm talking about one of the most common complications of giving birth. It affects about 1 in 5 people, and it's the #1 reason people die after having a baby. This one is serious, and you have to watch. Hey everyone, I'm Dr. Jennifer Lincoln, board-certified OBGYN author and educator, and this channel I call the health class you wish you had in high school, but this is the health class I wish you had if you were having a baby, you've had a baby before and this happened to you and you wondered what was wrong with you, or you know someone who might have a baby or you're supporting one. This is a must watch. Before I do that, go ahead and like and subscribe, turn on the bell so you never miss an upload. Okay, here's what I'm talking about. You've just had a baby in the hospital. Everybody's coming to visit. Oh my gosh, she's so cute. Can we hold her? They're taking pictures. And you're there and you're numb, or you just feel like you want to get up and walk away. Or maybe it's a few weeks later and you're home and you can't sleep because you are so terrified that your baby will stop breathing while she's asleep. And so you stay up the entire night and you're starting to have really terrible thoughts about what could happen to her. Or you're just getting angry, or you just feel helpless and hopeless and you just want to walk out of the house and never come back. If you didn't guess it, I'm talking about postpartum depression, and we're going to cover postpartum anxiety and postpartum psychosis too, because these are things that don't get talked about enough and are super common. And I'm filming this in May during Mental Health Awareness Month because we have got to talk about this more. The overarching term for these conditions are perinatal mental health disorders. Perinatal means that they can happen while you're pregnant or after pregnancy. And these are conditions like depression, anxiety, bipolar, OCD that are diagnosed during pregnancy or within 12 months after giving birth. And I know we talk about all the time about postpartum hemorrhage and infection and really scary things like preeclampsia, but it is these disorders that are the most deadly for people who give birth in the United States. Death by suicide or overdose related to these issues accounts for over 20% of maternal deaths in this country, and they are all preventable. So let me say that again. These mental health issues are killing people in our country, and they affect 1 in 5 people who give birth. So you have got to know the signs, not only for yourself, but for maybe somebody you love or a friend who's having a baby and might not know what's going on. So let's talk about what these look like. First up, we've got the baby blues, which I think almost everybody has heard about. And there's a reason. It affects about 85% of people who have a baby. These are symptoms that show up usually within the first 1 to 2 weeks after giving birth. And it can look like what you think. So you might feel really happy one day, and then a couple hours later, you're crying at a commercial because the emotions are all over the place. You might be a little angry, a little irritable with your partner, but you're able to walk away, put your baby down, and come back and be in a different headspace. And these symptoms, they're not that serious. You're still able to function, and they often go away on their own as your own hormones level out. And not that you can't try things to make it better if it's happening to you. A big one is sleep. So trying to get sleep, get help, get rest when you can. That can definitely help. Also getting outside, getting exercise, making sure you're eating okay. But the main theme here is that they don't require a lot of intense treatments to get better, which is very different from the next thing I'm going to talk about. And the next is postpartum depression, also known as PPD. Think of this as a more serious version of the baby blues. This affects about 1 in 7 people who give birth, and that number may actually be higher if we're not diagnosing it in everybody. So it is super common. Common symptoms with this are feelings of depression, fatigue. You don't want to get off the couch. You do not feel any sort of bond with your baby. In fact, maybe you don't even want to be around them. You may even have thoughts of harming yourself or harming your baby. These symptoms tend to start around 2 to 3 weeks after birth, and they don't go away unless they're treated. And the fantastic news is that treatments work. We have lots of conditions, especially mental health conditions, where the treatments might not be that great. But almost 100% of people who get some form of treatment for PPD will get better. I want to emphasize that having PPD or any of these does not make you a bad parent. And if you're watching my video today, as you are feeling these symptoms, or you've recognized this in a prior birth and you thought it's because you weren't happy enough or you weren't thankful enough that you had a baby, that's not why it happened. These things just happen. I'm going to talk a little bit later about who is at higher risk for it, but these are legitimate disorders and you are not to blame. So what makes you more at risk for getting something like PPD or any of these disorders? Well, a personal history of depression or anxiety can certainly put you at increased risk, or a history that you've had this in a prior pregnancy. Also, family history of these kinds of things puts you at a higher risk. I want to really highlight, though, that Having a birth outcome that did not go as planned or you felt like didn't go well definitely puts you at an increased risk of having PPD. So that could mean having a baby preterm, even having a C-section that you weren't prepared for, being diagnosed with preeclampsia and having to stay in the hospital because your blood pressure was so high. And there's no threshold of like what counts to be serious enough. If it felt traumatic for you, it can certainly put you at risk. How do we diagnose PPD? We have great screening tools. The recommendation is that you're screened both in the third trimester of pregnancy and also in your postpartum checkups. But I want to stress that if you are feeling symptoms at any time, I don't want you to say, I'll just wait. I'm going to see my doctor or my midwife in 2 weeks. They'll screen me then. No, I want you to call your provider and get the help that you need and you deserve now, which leads to treatments. I said that this is really treatable, and it is. You might think, oh my gosh, she's just talking about medication. Yes, medications can be helpful, but they aren't the whole thing or the only thing if that doesn't feel right for you. But I will address, we do have medications, we have pills, we even have an IV infusion, we have different things that we can give to treat PPD remarkably well. You might be wondering, I can't take medications, I'm breastfeeding. We have so many medications that are safe and okay to use with breastfeeding, you can talk to your provider about them. The unfortunate thing is that it can take a few weeks for these to kick in. Doesn't mean you shouldn't try them, but you need to do some other things in the meantime if you're feeling like you need help. And that can mean sleep. You might say, Dr. Jen, I have a newborn, I'm breastfeeding, or I'm not, but I still have to get up every 3 hours. How the heck am I going to sleep? I hear you. And the goal is to try to get 1 4-hour stretch of consolidated sleep every night. So that might mean that you miss a feed or a partner helps, because we know that even that amount of consolidated sleep does wonders rather than being up every hour and a half and things are just so fragmented. When you sleep, you can see things so much more clearly. And if you need more than that, if you need a good night's sleep, don't be afraid to ask. Therapy is also a huge component of this. And at the end, I will include resources of online groups and therapists and lists to therapists who this is all they talk about. I will include at the end of this video and also in the show notes. And lastly, what to do if you've had postpartum depression before and you want to not have it in this pregnancy or in the future. Stay tuned. I'm going to talk about ways to prevent that. Okay, before I go on to the next thing, postpartum anxiety, what questions, thoughts, stories, have you had this before and you feel like you've never gotten to share? Please take that time, drop a comment in the comment section below. And if you're not already subscribed, go ahead and do that. Okay, postpartum anxiety, or PPA, is what it sounds like. So symptoms of anxiety after having a baby. So you might have your mind is racing, your heart might be racing, you might feel sweaty or nauseous. You may have panic attacks. Not everybody does. Or what I talked about in the intro where like you feel like you can't leave your baby if they're sleeping or they might die, they might stop breathing. It is normal for all of us new parents to have that thought, but we're usually able to like put that thought away. But if it's sticky and it can't go away and you don't sleep at night because you are staring at your baby or the baby monitor the whole night, that is one step too far and could be a sign of PPA. The treatment is much the same as postpartum depression, although sometimes we'll use slightly different medications to treat the anxiety component. And I want to stress that just like with postpartum depression, postpartum anxiety can represent a medical emergency, because if you have thoughts of harming yourself or your baby or someone else, we need you to reach out to your provider, your OBGYN, your pediatric provider, or call 911 or go straight to the emergency room. Because like I said, these disorders are one of the leading causes of death in people who give birth afterwards. Not because they bled too much, not because they had an infection, but because they harmed or killed themselves. And you deserve to stick around. The last disorder I'm going to talk about is maybe the scariest. It's postpartum psychosis. And this is what it sounds like. So the symptoms are people start hearing voices, or they might have hallucinations. They have no insight into what's happening. Often the way we'll see patients with this is their partner will bring them into labor and delivery or the emergency room and will say, she's not making sense and I'm scared and she's never been like this before. Thankfully, this is rare and only affects about 1 to 2 out of 1,000 pregnancies, but it is a true emergency. Now, it is true that having something like bipolar disorder puts you at increased risk for having postpartum psychosis, but the vast majority of people who have postpartum psychosis had no risk factors. And the treatment is usually hospitalization, both for your safety and the safety of the people around you. It usually involves consulting with a team like psychiatrists to help get medications on board, to help you get out of that mode and back to your normal self. It may also involve therapy, getting good sleep, and it can take a little bit of time, but it is well worth it so that you are around both for yourself, your baby, and your family. Okay, the last thing I'm going to discuss is how to prepare, because you might say, Dr. Jen, these all sound terrible and it sounds really common. What do I do if I don't want to have this happen to me? And I will say, first up, the knowledge is half the battle, because so many of us who've given birth, we just thought we were bad parents or there was something wrong with us. And so we just shoved it under the rug or under the carpet. Especially for people who've undergone IVF or who had to work really hard to get pregnant or stay pregnant, you may feel like you don't deserve to feel this way. And helpful people who are really not helpful at all may say, well, just be thankful you have your baby. Like, what are you so sad about? So knowing that these things exist is half the battle. If you've had these before and you want to prevent it next time or at least be more prepared, here's what you can do. Number one, talk to your provider. Let them know. I really struggled with postpartum depression last time, and I am really worried it's going to happen again. What can we do? And your provider can know, can keep an eye on you. If you are on medications, I am not giving advice, but I would strongly suggest that you stay on them because going off of them can cause rebound symptoms and make you at higher risk for developing these disorders postpartum. Arming yourself with support, whether it's education or support groups. I'm going to show you this website here called Postpartum Support International, or PSI. Phenomenal group, tons of fantastic information, as well as support groups. I want you to go to this webpage, dig through it, and see what can be helpful for you. And lastly, I want you to prioritize sleep. For some people, that means not breastfeeding. Or it means not exclusively breastfeeding and formula feeding or pumping during the day to have milk at night because they know that if they do not sleep, they will slide right back into really severe anxiety or depression. And I am here to say that what you need to do for yourself matters, and I don't care what other people say. Before I go, I cannot stress enough that you are not to blame for this. These things are common and they are treatable. And I don't want you to carry the guilt that you don't love your baby enough or your family enough, because what's important is to take care of you so that you can be around and take care of them. Okay, everybody, that was a heavy one, but an important one. Please share with people where you think that this could be helpful. Drop your questions below, like, subscribe, follow me on all my other socials. And until next week, stay well, take care of yourself, and be safe.